Frequent asked questions about acne, Part 2. 11. How long before I see a visible result of using my acne medication? The time for improvement depends upon the product being used, but in almost all cases it is more a matter of weeks or months instead of days. Most dermatologists would recommend the use of a medication or combination of medications daily for 4 to 8 weeks before they would change the treatment. It is very important for patients to be aware of this time frame so they do not become discouraged and discontinue their medications. Conversely, if you see no change whatsoever, you might want to check with your dermatologist regarding the need to change treatments. 12. Would they use my medication more frequently than prescribed speed up the clearing of my acne? No, always use your medication exactly as your dermatologist instructed. Using topical medications more often than prescribed may actually induce more irritation of the skin, redness and follicular plugging, which can delay clearing time. If oral medications are taken more frequently than prescribed, they won't work any better, but there is a greater chance of side effects. 13. My topical treatment seems to work on the spots I treat, but I keep getting new acne blemishes. What should I do? Topical acne medications are made to be used on all acne-prone areas, not just individual lesions. Part of the goal is to treat the skin before lesions can form, and to prevent formation, not just to treat existing lesions. Patients are generally advised to treat all of the areas, forehead, cheeks, chin, and nose, that tend to break out, rather than just individual lesions. 14. My face is clear. Can I stop taking my medication now? If your dermatologist says you can stop, then stop, but follow your dermatologist's instructions. Many times patients will stop their medication suddenly, only to have their acne flare up several weeks later. If you are using multiple products, it may be advisable to discontinue one medication at a time and judge results before discontinuing them all at once. Ask your dermatologist before you stop using any of your medications. 15. Does it matter what time I use my medication? Check with your dermatologist or pharmacist. If you were taking 1 dose a day of an antibiotic, you could probably take it in the morning, at midday or in the evening, although you should pick one time of day and stay with it throughout your treatment. With oral medications prescribed twice a day or 3 times a day, you should try your best to spread out the doses evenly. Some antibiotics should be taken on an empty or nearly empty stomach. For optimal results with topical treatments, you should strictly follow your dermatologist's recommendations. For example, if instructed to apply benzoyl peroxide in the morning and a topical retinoid at bedtime, it is important to follow these directions strictly. If the two were applied together at bedtime, for example, you could decrease the efficacy of the treatment because of chemical reactions that make them less effective. 16. I have trouble remembering to take my oral medication every day. What's a good way to remember? What should I do if I forget a dose? This is a common problem. Many patients try to associate taking their medication with a routine daily event such as brushing teeth or applying makeup. It also helps to keep the medication close to the area where the reminder activity is carried out. In most cases, if you miss a day of your oral treatment, do not double up the next day. Rather, get back to your daily regimen as soon as possible, but there may be different instructions for different oral medications. Ask your dermatologist or pharmacist about what to do if you miss a dose of your particular medication. 17. I have been using topical benzoyl peroxide and an oral antibiotic for my acne and have noticed blue, black and brown marks developing on my face and some discoloration on my body. The marks are especially noticeable around acne scars and recently healed lesions. Is this a side effect of medication, and is it permanent? It is not possible to make general statements about the side effects of medications that apply to individual cases. A dermatologist should be consulted. The facial marks and body discoloration described by the patient, in this case, do fall within the range of side effects of some antibiotics. Unique patterns of pigmentation are sometimes seen in acne patients treated with certain oral antibiotics, particularly minocycline. The pigmentation patterns that appear may include localized blue, black or brown marks in and around acne scars and in areas of previous acne inflammation. A muddy skin appearance that may cover much of the body. Diffuse brownish pigmentation of the feet and lower legs. The pigmentation side effect gradually disappears after the therapy is discontinued. Any side effect of medication should be noted by the patient and brought to the attention of the physician. While most side effects are temporary, they should be discussed with the physician and monitored. 18. My doctor is prescribing a topical retinoid for my acne. He said a retinoid is a substance related to vitamin A. If the drug is related to vitamin A, shouldn't vitamin A dietary supplements be helpful in getting rid of acne? Dietary vitamin A is essential to good health, especially vision. It has healthful effects in the skin. Large doses of vitamin A for the treatment of acne is not recommended on grounds of safety. The retinoids and retinoid-like substances used as topical treatments for acne are prepared especially for their potent effect on the shedding of cell lining in the sebaceous follicle. Their use should be monitored by a dermatologist. Dietary vitamin A has multiple health effects on the human body. Vitamin A is essential for good vision. Extreme vitamin A deficiency can result in blindness, usually accompanied by dry, scaly skin. Vitamin A overdose that far exceeds the recommended dietary allowance, RDA, of 5,000 IU can have effects nearly as catastrophic. Extreme vitamin A overdose can cause the skin to blister and peel, an effect first seen in early North Pole explorers who nearly died after eating polar bear liver that has an extraordinarily high vitamin A content. Topical retinoids are usually prescribed as a treatment for moderate to severe acne. Side effects are chiefly dermatologic, including redness, scaling, and dryness of the skin, itching, and burning. These side effects can usually be managed by adjustment of the amount and timing of retinoid applied to the skin. Dose adjustment must be discussed with the dermatologist who prescribed the treatment.